Hi, my name is Brian, and I'll be doing my capstone paper looking over how sugar-sweetened beverages affect teens. A quick overview of my abstract is in Hawaii there is a overconsumption of sugar-sweetened beverages in the youth. SSBs are linked to a increased risk of diabetes, heart disease, and dental decay. SSBs can exacerbate the pre-existing conditions and prolong and worsen current conditions. On average, an American will consume 152 pounds of sugar in 1 year, equating to 3 pounds in a week. This equates to roughly 2.5 pounds over the weekly limit. A tax on SSB will reduce the intake and want for sugary drinks, resulting in a healthier community, and this paper will explain the devastating effects of sugar on the youth and the ways to combat them. There are four main determinants: genetic, behavioral, environmental, and medical. Genetic determinants includes a GLUT2 protein that has been closely related to fullness. A mutation in this gene can cause a person to have abnormal eating patterns. This can lead to periods of overeating or undereating, both of which can cause future problems. Behavioral determinants includes the power of craving. Craving can lead to misuse and abuse of SSBs. Abuse of SSBs can lead to an increase in the dopamine baseline, creating more want in the future. Environmental determinants includes how food environments and obesity have been linked if there is easy access to inexpensive and convenient snacks. And medical determinants are linked to increased risk and worsening effects of many diseases if SSBs are abused. And in my presentation, I have focused on environmental determinants, as environmental determinants has a higher ceiling for change. Changing the environment in which someone lives in is more reliable than asking for an individual to change themselves. So there are two studies I pursued. The first study to the left shows that school-based education programs focused on reducing SSB consumption and incorporating follow-up modules may help health professionals the best opportunity for implementing effective and sustainable interventions that could be effective in both children and adolescents. The second study on the right, and the study that I've chosen to work on and expand, was the environment of the population and how that alone can increase the risk. The solution was to implement a tax on sugary drinks to deter them from buying and consuming. The main reason for me choosing this is the cost and potential benefits. The cost would increase SSBs. This would be a fairly simple change and would deter people from choosing SSBs. With the increased tax on SSBs, the extra income could be put back into the fight to stop SSBs, creating sort of a win-win situation. Potential benefits are wide, but in short, reducing a large number of possible health conditions, creating a healthy population, and if patients were to find success in a healthier diet without SSBs, they might venture out and try other healthy alternatives. Just to reiterate a little bit, I would implement the economic tool that increases the price of SSBs to decrease the sales of SSBs. Also, implementation of discounts on lower calorie beverages. And my proposal is a straightforward plan that would focus on increased taxes on SSBs to deter them from drinking them. This bill will focus on teenagers as they are at higher risk of excess SSB intake, ages 8 to 18. The target locations are schools, convenience stores, and restaurants, and the primary intervention is to reduce the intake and availability of SSBs to teenagers. For process, I have chosen collaboration network. I have chosen letters of collaboration for trade and industry, as this will be essential to creating a strong push towards my cause. Having letters of collaboration ensures that everyone is on board and committed to this, and aids as further proof when trying to get the bill passed. For outcome, the expected behavior change, 10% reduction in consumption of SSBs from baseline. This seems reasonable, yet shows that the bill is effective. For impact, expected decrease in health problem associated with high sugar intake, obesity, diabetes, and blood sugar levels. This is an increased health risk when it comes to consumption of SSBs. Stopping or slowing consumptions can have a direct impact on population health. And lastly, the conclusion, SSBs have been made more widely available to all age groups and more convenient than ever to be obtained in Hawaii. Having control over SSBs will greatly increase the health of the youth and hopefully create better habits in the future. And I just want to thank Dr. Ellingson for having me through the process and Dr. Schumacher. Thank you.